Hey, how you doing?
I'm good. How are you?
So, tell me what happened.
So I was playing lax with my Sigmas, and then while I was passing the ball, I felt something wrong in my shoulder. No, I consent.
So you have like a grade 1 shoulder tear. It's nothing too bad. It's just like your muscle kind of stretched a little bit with a couple tears in it in the muscle. So we're going to want you on the ice, and we're going to use some exercise getting going. That way we can get it kind of more together, and then re-strengthify it. So the grade 1 means that you've stretched it, but not completely torn it. That would be grade 3. Grade 2 is kind of in the middle, but still with grade 1 there's a little bit of tearing in the muscle. But it can come all back together, so that's what we're trying to do. So we're just trying to get it all back together, and it's still going to be still stretchy, because it's not going to go back to like it was before. It's not like it's like elastic, you know. When you pull on it, it doesn't come back to its original shape.
Go. So, what happened?
So I was outside playing around. I ran a route, and I took a step, and my ankle went out, and I fell down and started hurting a lot.
Yeah. Alright, you hurt like this?
Yeah, like that.
Alright. So from what I can see, and I've diagnosed, you have experienced an ankle sprain. That's part of it. You have experienced a inversion ankle sprain. You have when you put it like this, you stretch the ligaments and eventually tore just a bit, so that's why you're experiencing pain or discomfort and some other things. If you want to heal it, you want to rest it and make it better. I suggest, me personally, I suggest you gotta avoid putting weight on your ankle, and you gotta ice it for 15 to 20 minutes a day. And then there's some various exercises that you could do to help strengthen your ankle.
Go.
Yo. This is great. I think my jaw's broken.
I'm Dr. Singh. What's wrong with you today?
Hi, Doctor. Thank you for meeting with me today. So I was doing a boxing match, and I got punched, and it hurts when I move my jaw. To a certain extent, like around here.
Can you open your jaw just like this?
It hurts around here.
So basically, when you got punched, you overstretch that joint, so that's why you're feeling discomfort there. So right now, what I can recommend is, since it's a new hit, it's gonna hurt for a while. So right now, I recommend taking rest and then not using your jaw too much. So giving it a lot of rest. So that means not talking too much. And if you're gonna eat anything, I recommend not eating chewy foods, anything that's really gonna strain your jaw. And I also recommend to reduce swelling. I sit for maybe 15-20 minutes a day, and you can do that multiple times throughout the day. If you really need to, if it really hurts, you can take pain relievers like ibuprofen to reduce swelling, but I wouldn't recommend. But if it really hurts and you have to take some, you can. Also, when you feel like your jaw is a bit rested, I recommend doing a couple exercises, just moving your jaw back and forth, up and down. So just you can re-strengthen your TMG joint.
Thank you, doctor.
Some additional information about shoulder tears is they can involve various structures such as the rotator cuff tendons, labrum, which is like a ring of cartilage that surrounds the shoulder socket, or other ligaments in the shoulder joint. These are among the most common types of shoulder tears. They often occur due to overuse, repetitive motion, or acute trauma. Rotator cuff tears can range from partial tears to complete tears, where the tendon is fully detached from the bone. Basically, what this means is shoulder tears can be both acute and chronic. Acute meaning they happen suddenly, maybe like one event or quickly, and chronic means it slowly tears over time. For recovery, we recommend using the RICE method. So basically, the R in the RICE method stands for rest. So you want to rest that injured part as much as possible for the first 2 days of the injury, so 48 hours. You also want to apply ice every 2 to 3 hours during the first 48 hours, and I recommend icing for 20 minutes at a time. And you also want to compress the injury, but you want to make sure you don't compress it too hard. Otherwise, there's a chance that you could cause it to inflame even more. And The E stands for elevation, but since this is a shoulder tear, it might be hard to elevate it. But the Rice method is always good for any injury. The majority of ankle sprains, roughly 90%, are inversion sprains. They typically occur when the foot rolls inwards, causing the outer ankle ligaments, such as the anterior talofibular ligament, hopefully I said that right, to stretch or tear. There are 3 grades to ankle sprains. Grade 1, which is a mild sprain with stretching but no tearing of ligaments. Grade 2, which is a moderate sprain with partial tearing of ligaments, causing more significant pain and swelling. And grade 3, severe sprain with complete tearing of ligaments, leading to instability and possibly requiring more extensive treatment like surgery. Basically, when this happens is you want to use the Rice method, as I previously talked about, for the first at least 48 to 72 hours of that injury. And then once that injury starts getting better, if it's not grade 3, if it's a low version of grade 2 or grade 1, you want to start doing strengthening exercises, which includes like balancing training. You also want to be wearing appropriate footwear for activities to make sure your ankle's getting the most support as possible. And using ankle supporters or braces during high-risk activities can also help prevent future sprains or even injuring this one more to a greater extent than what it is. This injury, I can talk to them about personal experience. So this is a jaw sprain, and more in detail, it is your TMJ joint, which is located on each side of the head, just in front of the ears. It is composed of the mandible, which is the lower jaw, and the temporal bone of the skull, separated by a disc made of cartilage. So like the primary function of the TMJ joint is to facilitate jaw movement, which includes like chewing, speaking, and yawning. It allows for both hinge leg movements, opening and closing, and sliding movements. Self-care measures. So what you want to do is you want to rest your jaw as much as possible after your injury. You want to eat soft foods, but don't eat chewy foods because that'll really aggravate that joint. And you want to keep icing it. You want to keep icing it for at least 48 to 72 hours, 20 minutes every couple hours at least. So once you think that it's starting to feel a bit better, some physical therapy that my doctor told me when it happened to me was to just stretch it out, strengthen your jaw muscle, which is like open your jaw, move it side to side. I explained it to Daniel in the video, but I just want to explain all of these injuries a little bit more because we didn't get all of what we wanted to say in the videos. But it's always a good idea to also go visit an orthodontist because any injury that's near your teeth or on your head, it's always good to get one checked in a hospital just in case because head injuries are dangerous. And it's always good to go visit your dentist to make sure nothing's wrong with your teeth. Those are all of the injuries and our videos. Sorry I went too much into detail at the end. I just wanted to make sure because in our video we tried to actually act like doctors and not give too much sciencey information. But I also wanted to make sure that you knew that we knew all of this sciencey stuff. So I'm sorry for talking way too much at the end with the pictures, but this is our 3 injuries, which is our shoulder tear, ankle sprain, and our jaw sprain. Thank you.